Hello and greetings. Welcome to another session of our grief program that we have brought to you by Uhai for Health and Mosaic Opioid Recovery Partnership. My name once again is Dr. Stem, and I want to welcome you to week number 4 of the 8 sessions that we'll be doing. Last week, we spoke about depression and grief. And this week, I decided to talk about understanding anxiety with grief as well as anxiety in general. Because when we talk about grief, our culture tends to treat it only as an emotional event, something that is only related to our feelings, our thoughts, and our tears. We hear phrases like, give it time, try to stay strong. But anyone who has walked through profound grief and loss knows that grief does not live only in the mind. Grief also lives in the body. So, grief is a full system that impacts our heart, our immune system, our attitudes, our hormones. It alters our immune system and also reshapes the way that we think, our cognitive thinking. So, our purpose today is to be simple, to connect the dots, to understand anxiety when grieving in general, to understand how we can support ourselves as well as how we can support others in our lives, including the children. So let's begin by exploring what happens to the physical body when we are grieving or when we experience loss. When we experience a significant loss, the brain automatically understands this to be a threat and disastrous disruption to our safety and attachment. So our nervous system immediately moves, it shifts in what we call a survival state, placing strong demand on the heart in order to protect ourselves and to protect our bodies. So for some people, their blood pressure goes high, and in some severe, serious cases, this stress that you go through when you're grieving leads to what medicine officially calls takotsubo cardiomyopathy, commonly known as broken heart syndrome. So the immune system goes into what we call overdrive. This is why people who are grieving or experiencing the pain of loss are far more vulnerable to getting sick, to getting viral infections, to getting flu-like symptoms, sometimes even just flare-ups of body aches that you probably haven't felt before, but all of a sudden you start getting these pimples or you start getting those breakouts or the body just starts to be painful. We also cannot overlook the digestive system because it affects the way that you eat. Foods that you usually will eat sometimes become food that you don't even want to eat. And some people compare to the, woman when she's pregnant and cannot eat, the same foods and will throw up. And sometimes will eat something that they haven't ate before and sometimes just don't even want to eat anything at all. It happens and it's normal when you're going through grief until such a time when now it has prolonged, gone for too long, and you're not able to get back into um, a routine that you can eat again to replenish the body. There's also physical exhaustion that happens, the tight chest, the upset stomach, as I mentioned, the aching muscles, they are all directly related to the biological, effects that happens when you are grieving. So the brain, we have to understand, also how the brain is affected, at a higher level. One of the most distressing experiences for grieving people is what commonly known as grief brain or grief fog. People forget They begin to forget their words, they forget people, they forget what they're supposed to be doing because they are now in this, space where they're grieving. This loss has hit them so hard that they don't know or don't remember anymore the simple things that they would be remembering. They start missing appointments, getting late to work, and just unable to make the decisions, even as simple as going to the grocery store. You find it very difficult. What did I come here for? What do I want in this grocery store? Or you get yourself in a car and start driving, and then all of a sudden it's like, I don't even know where I'm going. Why did I get in the car? This is not uncommon. When you're going through grief, you also find yourself unable to sleep, or maybe sometimes sleeping for long periods of time because your brain is tired, the body is tired, the nervous system is, exhausted. So what happens is it does not permit, you to go into deep sleep at that point because then emotions are running all over rampage at this time, during the grief period. So as a result, many people, whether we are going through grief or not, we experience what we call generalized anxiety disorder, and it affects all of us. If not most of us, at some point or another, we have, experienced generalized anxiety disorder. So, because we have this great experience, opportunity to talk about, our mental and physical health, I decided I will add on to talk to also people about just generalized disorder in general, whether you're grieving or not. So the most common anxiety is what we call the GAD, which is the generalized anxiety disorder. So occasional anxiety, we all feel a little bit of anxious, a little bit of nervous, which is normal part of life. So many, if not all of us, at one point or another, have experienced such, anxiety or such worry about things like, health, money, school, marriages, work, family. We've all felt a little bit of anxiety. But people that have struggled with the generalized anxiety disorder, they feel extremely worried and extremely nervous. And the nervousness is more intense about the same things that all of us might struggle with. But this anxiety comes in more intense when they think about their health, their money, their school, their family, their work. Generalized anxiety disorder involves a persistent, ongoing feeling of anxiety or dread, which is just being scared of doing something, in your life or even in the workplace, especially with the COVID-19. A lot of people experienced anxiety once we started working at home and being exposed to the computers and sitting on computers for long periods of time, or even looking on the phone and being on the phone for long periods of time. A lot of people developed anxiety disorders after the COVID-19 or during the COVID-19, and now, even now, post-traumatic, stress is affecting a lot of people where now we're not thinking the same, but then the heart just beats, and you get scared. So with generalized disorder, anxiety disorder, it develops gradually, and usually research says it starts in early adulthood, but to be honest, it also can occur at any age. So even children, teenagers, adolescents will also struggle with generalized, anxiety disorder. Some researchers say it's more prevalent, or it occurs more among women during pregnancy or after pregnancy during their postpartum depression, postpartum time, where they experience depression, postpartum depression, as well as anxiety. So some researchers say, especially for women, we need to pay attention to our bodies because we have, a high uh, tolerance where we might be able to be exposed to anxiety more than the male counterparts. And there are some researchers that also say, well, men are just as worried as women. And I think that's the truth because what happens is men usually will not express it. Even though sometimes they will feel those anxiety and emotions and feelings just like women do, but they don't express it. So as a result, there's been less research among that, but we have more men now that are, thank God, being outspoken and saying, you know what, I will seek help because yes, I've been experiencing anxiety. So some of the signs and symptoms of generalized, anxiety disorder, you may feel worried excessively about everyday things, have trouble controlling your worries or feeling nervous, feeling irritable and on urge, feeling restless or having trouble relaxing and calming down, having a hard time concentrating or focusing, having trouble falling asleep or staying asleep, or just feeling exhausted all the time. Some people experience headaches, muscle aches, stomach pain, or even twitching or just shaking and trembling. Some people sweat a lot and they also express that they can't breathe and continuously are feeling as if they're out of breath. And there are some that say they have a hard time swallowing, anything when they're anxious or feeling anxious. Some people make frequent trips to the bathroom, they urinate a lot, and some have trouble especially getting up and going to work. It's almost like, depression per se in some instances, some of them. But then again, that focusing where I talked about difficulty focusing and again, forgetfulness at that point. Some people will have that extreme anxiety that they struggle with. So I mentioned that children and teenagers will also experience the generalized anxiety disorder. So children may worry about many things, which are similar to the adults, but their concerns often are on school, the extracurriculum, activities that they do, their friendships, their future. So sometimes when you see or hear the children, talking about their worries and their things that they're struggling about, to us adults, it might sound like, what? Don't worry about them. Forget about that. No, don't even think about it. It's really nothing. And yet, for them, it's really something that is big that they may struggle with, and it will affect how they function on a day-to-day basis, and especially function in the school. So it's important, for parents to be able to make time to really support and find the help that your teenager or your child might be experiencing at that time. The symptoms will be very similar to the adult symptoms that we have. And in order to get the right diagnosis for yourself or even your child, I always recommend take them into a professional so that they can have a full, thorough assessment on what is really, really going on. So sometimes, because they're not able to express what is really going on with them, it might be you see them with anger outbursts and just frustrations, easily out frustrated, not be able to concentrate, focus, or to follow directives, from you. Those might be sometimes also the result of stress that they're going through, but sometimes it could be anxiety. So just getting checked with the regular doctor and say, this is something that I've been seeing, but I don't know what is really going on with my child. They will get the right diagnosis and the right direction, for you. So as far as you helping your child, let's go through a few things that you might be able to do. So the goal is not to eliminate anxiety. The goal is to help your child manage the anxiety and be able to be functional. I mean, none of us want to see a child that's unhappy. But the best way to help kids overcome anxiety is not to try to remove the things and surroundings that, that is in your place, right? It's actually to help them to learn how to understand what worries, is, what anxiety is, so that they'll be able to function. Because then if we say, well, you've got to move your apartment and go to a place where there's more room and it's a bigger house, well, that's not practical. And it's not, something that can happen for everybody, or take them in this community because then, they don't want to stay in this certain community or environment. That's not going to be something easier. So what happens is we try to help them to function and to be able to work through where they are with you right now, but to be able to work through that anxiety and find coping skills that they can cope with. Do not avoid, things just because they make your child anxious. Helping them with the things that they are afraid of will make them feel better in the short term. But it also reinforces them over the long run that it's okay and I am safe when they're exposed, and they can, little by little work through their anxiety and the things that scare them the most. So let's say a child is in an uncomfortable situation, gets upset and starts to cry, not to be manipulative, but just because that's how they feel. If their parents just goes ahead and takes them out of there and removes them, from that environment, the child has learned that, oh, so if I get in a place where I don't want to be, I can just cry and throw tantrums, and then my parents will just come and whip me away and take me away, and I don't have to worry about anything. And you will see that cycle repeating itself, where now you're like, well, you're no longer 7 years old, you're 8 years old, or you're now 15 years old, and you still act like you're an 8 year old. It's because sometimes we are not aware of it, but we teach and the children what they learn and continue to unconsciously practice the same thing, even when they are grown, and think, you know what, I can just walk out of this classroom and walk out of this place because I don't have to stay here. And then it starts to be a problem with the parent. What do you mean you don't have to stay there? You need to be there. But then remember now, they are used to the times where grandma used to come in and take me out without me even asking for it, without me even saying anything. So now, what do you mean I have to ask for help to be taken out of this environment? I don't need to. I'm just walking out because I don't like being here. That's another, downside of doing that. Express, positive but realistic expectation when you have a child who's also struggling with anxiety. Well, it's true. You can't promote a child that, and tell a child that their fears are unrealistic because, as I mentioned, to them, they're really real. So you can let them know that, as they face these fears, the anxiety level will get better with time if they continue to at least take a step forward and deal with that anxiety little by little. They will at some point get a hang of it and be able to manage the symptoms of anxiety. And again, as we always encourage, parents to do, if it's something that you have talked to the children and it's still not improving, please seek help and get support, because it's not easy. And that's why they have, trained professionals that will handle situations like that and help you with behavior problems, mental health problems, with your child. So when you're talking to them, here's one thing: don't ask what we call leading questions. Encourage your child to talk about their feelings, but try not to ask leading questions. Are you anxious about the big test? Are you worried about the science fair? You worried about that girl? Are you worried about that guy? So to avoid feeding the cycle of anxiety, because those kind of questions will be feeding the anxiety, just ask an open-ended question. How are you feeling? How are you feeling about your science project? How are you feeling about your science exam? That just opens up for the child to tell you exactly what they're feeling about the anxiety, about the science project, or to say, nothing. I don't think that, I'm worried about it or anything, because sometimes some people will want to mask the struggle and the suffering, but it makes a big difference because you've asked, they start now to think about it to say, oh, am I showing that I'm worried? Is there something that I can do? And just open yourself up to say, hey, if you need to talk, just let me know. And you can come and talk, to me. So think about things that can help your child when they're anxious. Talk to them. Also share with them, some of the things that they can do. You can sit down and just, at least take some deep breaths to, breathe and, feel relaxed. Or they can come and talk to you. But again, there are many things that they can do to help with the anxiety. It's always best if also your child can work with a therapist that can help them with the right breathing techniques where they'll be able to grasp what's the best way for me to breathe during anxiety and what's the best way for me to also breathe when I am frustrated and stressed out. So that's for you as well as your child as well, because then even for us, the breathing exercises and, knowing how to breathe well can be very, very helpful. I have seen a lot of videos on YouTube University about breathing to calm or calmness breathing. Go on YouTube and just get one of those videos that they have and breathe using the videos to help calm your mind and just relax, your body. So let's talk about stress and anxiety. Because life can be stressful. A person may feel stressed about a lot of things in this day and age: the job, the performances at the job, the supervisors, the colleagues can be frustrated and stressed out about life changes. As we grow older, yes, it's fun and we celebrate a birthday, but then that each birthday comes with its own changes, physical, mental, spiritual changes that we have to deal with. And that's part of life. It can be very stressful. So everyone feels stress from time to time. Stress is that physical and mental response to an external cause, such as having a lot of work to do, a lot of illnesses that you're struggling with, or a family member is struggling with at that time. So there's so many things, that one can experience and go through that can cause us stress. So the question is, what's causing you stress right now? If you're listening to this and you have somewhere to write, on it as well, and for those of you that are here with me, just jot down a few things. What's stressing you right now? Because it's important to take note of the things that are stressing you out, and also, it'll be easier to figure out, okay, which of these things can I deal with right now? Especially about control. Because when you list the things down, let's say you write 5 things that are really like pressing. If you write more than 5 things, then number them up. Which one is the most stressful but most urgent that needs to be taken care of? One, two, three, four, five. But out of those five, what can you control and what can you not control? That's always going to be the question. And what you can control, please do it like ASAP and get that done. So, what causes the generalized anxiety disorder that we spoke about, earlier? Generalized anxiety disorder or anxiety in itself can run in families where you have, family members that have, struggled with that. So it becomes genetic that you're born with it. Research, suggests that the generalized disorder results from a mix of genetics, the brain chemistry, biology, the environment that we are in. They also found that external causes, such as experiencing a traumatic event, which in this case we are talking about grief and losing a loved one, can also bring in a stressful environment and then putting you at risk for the generalized anxiety disorder. So, to be diagnosed with GAD, generalized anxiety disorder, you must find it difficult to control your worry, which means when you are asked, you know, what has been going on, you say, for the last 6 months, I really have not been able to settle down. I haven't been able to sleep. I have difficulty eating and sleeping and just focusing. I just can't seem to focus. And it's just becoming more and more that I'm getting worried even more for what other people might say for no reason at all. But for me, it makes sense. And I'm just finding myself worried about that one or two things over and over and over again. So it has to be where you have had difficulty controlling your worry for for most of the days for 6 months. And you also must have three of the following symptoms in order for you to get that diagnosis. You would be feeling restless. You'll be feeling on edge. You'll be feeling fatigued mentally, emotionally, physically, just exhausted. Might have trouble concentrating and focus, but then getting irritable will be one of those symptoms that you can say, muscle tension, and also problems with sleep. So if any of these and you've been struggling with it, and you know that whether it's 6 months or less, that it's really a problem that I need to make sure that I get diagnosed, please reach out to your primary physician or a therapist to get a thorough evaluation assessment as well as diagnosis. So, what other illnesses can come in when you have generalized anxiety disorders? Some people that have this kind of, anxiety disorder have other mental and physical health disorders at the same time. So they might have their anxiety disorders, but they might also have post-traumatic stress disorder, chronic pain syndromes, cardiovascular problems, suicidal thoughts and behaviors. So there are other, symptoms that will be, eh, that one will be struggling with that includes those ones. So it's commonly also when you have the GAD, generalized anxiety disorder, it's also commonly associated with alcohol drinking, smoking, weed, substance abuse in general, that many a time from the research that has been done as well, we find that there are many people that have the generalized anxiety disorders and they take to drinking as well as doing drugs so that they can find relief, from this illness. So how is it treated? It is treated in several ways, right? Treatment typically involves psychotherapy, which is talk therapy, which is what I do, talk therapy, providing therapy where we get to talk, but also we get to talk about some coping skills on how you can better manage your anxiety. Sometimes just talk alone, just talking might not work because then one will continue to feel the same way, to have the same flares coming up. If that's the case, then please seek, treatment as well as, talk to someone for the talk therapy. But then now you might need medications at the same time to help you with the sleep, to help you get energy, to help you stay focused. So that again, now when we do your talk therapy, it makes more sense, but you're not struggling. So with the medications, I know a lot of people, it's very tricky. Please make sure you go to a trusted, person that will be able to monitor you on the side effects of the medications and also seeing how the medications work. So I don't want to discourage anyone from taking medications or encourage anyone to take medication. I encourage you to seek treatment so that a professional or medical doctor can correctly, diagnose you and then make the recommendations of what could work for, those anxiety or any ailments that you might have. There are also support groups in all the areas that you're in that you can go and Google support groups for grief, support groups, or even, anxiety groups, depression groups, business groups, if you want to do a business, employer groups that, you can meet up with other people that are employed somewhere and fun groups. So, I mean, social support is really, really key and very important when you're struggling, with any mental health, at all. So sometimes that's helpful and sometimes it's not for other people that have a difficult time opening up in front of strangers, because definitely you'll be meeting strangers at that time if you go for um, their their support groups. Also, don't forget healthy habits, exercising, walking, listening to music, just finding things that make your vibration, you know, um, good, or, as they call it today, the good vibes. That gives you the good vibes. That's really, really good for your health and also, treatment as you'll be going through, anxiety, excuse me. Stress management, techniques like mindfulness, meditation, those can help reduce anxiety symptoms really, really good. I believe in meditation and mindfulness. That's really good. Educate yourself. A good way to help yourself or a loved one who may be struggling with anxiety disorder is to seek information, research the signs of symptoms. Again, get brochures. This video will be good because then we are talking about some of the symptoms in here as well. Learn about the treatment, options that you have so that again you can support yourself and support others. If you're experiencing generalized, anxiety disorder symptoms, it's really key and very important for you or a loved one to have an honest conversation about how you're feeling with someone that you trust. If you think a friend or family member may be struggling with GAD themselves, set aside a time to talk to them, to express your concern and reassure them of your support. Keep, you know, um, believing and also knowing that it is manageable. So anxiety disorder is manageable. So is depression. It is manageable. So be open to the options that you have of finding a way to reduce the symptoms, but for you to be more functional and also more productive. So if your anxiety or a loved one's anxiety starts to cause problems in everyday lives, such as school, work, with friends and family, then it's time to seek professional help. Professional help means it's really an opportunity for you to relax, replenish, and share with someone who will be able to help you come up with better coping skills that will work with you. Be kind and patient with yourself and others. Acknowledge the progress that you're making, no matter how small it is. Do what you need to do to take care of yourself and then embrace and celebrate you for having done that and taking the opportunity to get help. So, this is real quick about, choosing the right treatment, for you. We spoke about the psychotherapist, which is the talk therapy, medication, support groups, as well as doing healthy habits, which is the exercise, and everything that you can do. So again, just like, the depression, remove the expectation to fix it. I want you to focus more on creating an environment that you can manage it better for yourself and also manage it, for the family and help your family members, manage it. I wanted to, before we end here, to just talk briefly about, starting conversation when you're helping others, because someone had asked. So as we talk about anxiety or even, the depression, right? It's an overwhelming feeling for anxiety that you or someone, a loved one, will feel. So anxiety in itself is really extremely overwhelming feeling of fear, dread, and worry, which can make it hard for people to just be normal and live their everyday life and do everyday activities. So you letting a friend or a loved one know that you support them can really help them. So use these tips to start a conversation. Showing that you care, you can say, "How are you feeling? I'm here to listen and support you. I'm worried that you've been feeling anxious lately. Let me know if you want to talk. I care. I care about you and just want you to feel better. Do you want to grab lunch and maybe talk about it?" When you are reminding them that things can get better, you can say, "Let me tell you, lots of people deal with anxiety. So it's really nothing to be ashamed of. And from my understanding or from my experience, it actually does get better with treatment. There are therapies and medicines for anxiety. So getting the treatments is probably one of the best things that you can do for yourself. And you can also say, I know asking for help could be hard or can be hard for you, but getting treatment can help you get back to your own normal activities. So offer to help. And when you're offering to help, you can say things like, I want you to get better. Can I help you make an appointment with your doctor? How can I best support you? You can call or text message me anytime if you need support. Or if you just want talk, just talk, call me or even text message me. You might feel better if you talk to people who are going through the same things as you. Would be your way of encouraging another to join a support group that, yes, they will meet people that are also going through grief. It's never the same. Everybody has lost a different partner or relative, and everybody will grieve differently. But what we do here is encourage you to be with others so that again, that energy of wanting to get better can also rub on you, and you can also be of support to others that are looking for that energy, for that hope to see how they can move, their life, live their lives without their loved one, but live a new way of living. So another pointer before I go is many people who have anxiety also have depression. So check in on your friend or loved one with anxiety, so that again you get to support them fully with what they will be going, through. So if you wanted to know if they have depression as well, you can ask things like, "Do you feel safe? Have you felt hopeless and thought about hurting yourself recently?" And yes, let them know that you're here for them and they can talk to you when, they want to talk to you, but make sure your boundaries are there. You can talk to me at any time, and you know me, as long as it's before 7, and I don't have a client, then yes, please reach out to me. But if I don't answer, it's because of the two things. I'm either in session with the client or I'm already sleeping and my light is out. So I do have a handout. As you know, each week I share a handout with you. Please take that handout, download that handout in our group, right in the WhatsApp group, and you'll be able to see the link to the video as well as the handout. If you have any questions, please send me the questions in the WhatsApp group, or you can send me direct questions, bounce back. Boutique is me. That's my, just in case you went into the group and you're wondering, so wait a minute, what is Dr. Sne where is Dr. Stem's link? It's linked to Bounce Back on WhatsApp. So that's where you'll be able to get that information, or you can just even email me at www dot no this is the website. You can email me at drstem14 at gmail.com. DRSTEM14 at gmail.com. Have a wonderful week until next time.